Welcome to the Beverly Hills Plastic Surgery Podcast. In our ongoing series of Plastic Surgery 101s, I am here today to discuss with you liposuction with the most knowledgeable and skilled plastic surgeon for liposuction that I know, Dr. Millicent Ravello.
Well, hello. How are you?
You've liposucked more than I have in your career.
Yes.
In terms of actual square footage and poundage, I can't get over the cases
that might
you do.
be true. In fact, I think Dr. Snibby says thank you because I have no liposuction my right shoulder into oblivion. I am not getting regular steroid injections.
It is a physically demanding specialty for us, but for our patients, there's a lot to know.
There's a lot. And I think it's very appropriate that we are doing this particular podcast 2 days after Thanksgiving when
Yes.
everyone in the country is going, oh, could use some liposuction.
And we're here to help.
And we're here to help. So yes, you could do a juice cleanse, or you could just come to us and you could have some liposuction.
Or both, which
Or
is the
both.
best combo.
All right, so what is liposuction? Liposuction at its core is exactly what it sounds like. You are using a suction device to remove fat, otherwise known as lipodystrophy or, whatever. It refers to fat.
It's fat you don't like.
Fat you don't like. And it is a very powerful, very useful technique to remove fat. I mean, it does an excellent job at what it's supposed to do. That's not the tricky part. The tricky part is what areas to liposuction, who's a candidate for liposuction, and what realistically can you achieve with the liposuction.
Right. And a frequently asked question is liposuction a good method of weight loss?
Not weight loss. So this is the perfect liposuction candidate. Let's start with that. Ideally, it would be someone who's an otherwise normalish weight, maybe a little bit overweight, normal for them, maybe a little bit, BMI up to 30, something like that is otherwise healthy, motivated to eat relatively healthy and work out, but still has these areas of fat, stubborn fat is what they're called, that they just can't lose no matter how well they eat or how much they exercise. That is the perfect candidate for liposuction because they're already doing everything right and they just can't get rid of these stubborn fat areas.
BMI, body mass index, it's basically your height versus your weight. And like for somebody like me, I'm like a 27, and 27 is like, you're kind of overweight. You should be like 25 or less is normal weight. 30 is like, you're starting to get into like
obesity.
Whoa.
Yeah.
That's too much.
So normal-ish to a little overweight is a good candidate. On the opposite,
so far I'm in.
So you're in. You're good. You're all set.
Okay.
On the opposite end of that spectrum is the person that comes in with a BMI of 40 and isn't really eating right and is definitely not exercising and is trying to use liposuction as a weight loss technique. No.
Doesn't work.
That's not the option. Liposuction will reshape you. It will get rid of those unwanted areas of fat, but you probably won't see much of a change on the scale. What you will just see is an overall change in your size and shape. You may see your pant size go down, but you probably won't see a big number change on the scale.
Yeah. And, really, I think of liposuction as a way of contouring areas that are not your favorite.
Right.
Love handles, abdomen, bra
Saddlebags.
Saddlebags.
Yes.
I hate sucking medial thighs. I hate it. I hate it. I hate it. They sag. They're difficult.
Right.
For all you people out there who are like, I'm going to get my medial thighs done. It just not so fast. Let's talk about it.
You really have to have a really juicy fat pad on the inside of your thighs for me to go after it because that is a rough place. So let's talk about the other thing that goes along with liposuction is skin quality, because your skin has different tightness levels and elasticity in various areas of your body. And on the inner thighs, the medial thighs, that is probably some of the thinnest skin in the body. And when you suction the volume out of it, when you take the fat out, it just does not snap back like skin elsewhere in the body might. And so then you get these like saggy skin areas. And now you're like in a medial thigh lift category where we're talking about cutting out skin and putting scars on your inner thighs. So if I do medial thighs, which we don't like either, if if I'm doing medial thigh liposuction, I'm very conservative with how much I take out.
Yeah, and that's what I tell everybody. I go, the problem with medial thighs, and and this is the inner thigh.
The thigh gap. Everyone wants the thigh
I know,
gap.
everyone wants to have space between
Yeah.
their thighs. We get it. But if you over suction it, because when you're doing liposuction, you're using cannulas, these long, thin metal tubes with holes at the end that are attached to a suction device, and literally you pump in some fluid to kind of fluff up the fat. Basically, it's called tumescent fluid, which everybody knows what that is. So the idea is you fill it up so that you can remove the fat. And as you're suctioning out the fat, you're removing the structure that's under the skin. And what's left is the skin that is the shape of whatever fat pad you have,
before, yeah.
which now needs to shrink wrap around what the remaining tissue,
is,
whether
yeah.
it's the muscle or the fascia or the remaining fat that's there. So the medial thigh, like the lateral thighs, your saddlebags,
Great.
they do great. They
Best
work.
area, yep.
You can suction those all day. Get them down to skin over bone if you want to, and
Don't
it's
do
going to be
that.
fine.
Yeah,
Don't do that.
that looks weird.
No, you got to make it look nice. But the reality is it's a very forgiving area. It heals great. I see a lot of over suction saddlebags where the female now looks male.
Yeah.
And if you're going for that, that's one thing. But in general, a lot of women want to still be sexy and curvy. And I see like you got to take away that amount of
The excess,
fat,
the bulges
but
out.
also leave the curves.
Yes.
You can't, if you skinny somebody down too much.
Yeah,
Doesn't look good.
that could be a tricky area too with the saddlebags because you want to leave some there, but it's easy when you're in that area to just want to go to town and get all the fat out. But you gotta leave some. That's where it comes to the saying we have: it's not how much you take out, it's what you leave behind. Because as you mentioned, this is a body contouring procedure. It's not a weight loss procedure. But all of these areas are great. So you can do the outer thighs, the inner thighs, abdomen, back, bra fat, arms. These are all areas you can do liposuction in.
The love handles.
The love handles, the flanks.
They work
flanks
great.
Are a great,
It works great.
Great place to do liposuction.
Totally.
But if you're getting to areas like the upper back, the abdomen, or the arms, this is where you have to start thinking about skin quality. So I will sometimes have patients come in, they've had 2-3 kids, they want to get rid of the extra mommy fat that's on their abdomen, but the problem is they also have a lot of loose skin. And so they're probably better served with a tummy tuck, because if I just do liposuction on them, they're going to have a lot of loose skin hanging down. And I've done that before. I didn't want to, but they patients wanted to, and I was so disappointed with the results because, yeah, they look a little bit smaller in clothes, but without clothes, it just doesn't look tight.
Right.
It looks loose and floppy. So you got to consider that maybe some of these areas you have to do some either skin removal, like a tummy tuck, or a brachioplasty, an arm tuck. Or there are other devices which we've talked about before that are energy applying devices like the Renuvion or laser lipo that provide an additional layer of tightening to the skin at the same time as the liposuction.
And the big term that gets thrown around now is high definition liposuction, like high definition television. High definition liposuction is just liposuction in a very aggressive style, where you're really
Very
thinning the skin.
Superficial. Like usually we leave a little bit of fat under the skin to sort of camouflage any contour irregularities, or to just, give a little bit of extra cushioning and padding to the appearance. But a high def liposuction, you go almost right up to the very underside of the skin intentionally, because you're trying to create basically what's a scar line, the skin sticking down to the muscle underneath and creating an indentation. So like that midline down the center of the abdomen, or on the deltoids, on the shoulders, to create these grooves that look like they are muscle definition, but really what you're looking at is a scar from the skin down to the muscle, and then the quote muscle is just remaining fat that's been left behind or placed there. Sometimes you can graft fat into those areas as well. So basically you're creating what looks like muscle definition by taking away fat and putting it in areas in a certain way.
Yeah, I like to say what I do is high definition light. I won't go for that skin over muscle look, because Though some areas do look awesome, some areas look
Weird.
really weird and really bad.
Some look weird.
And that is a problem. And picking the right candidate for that and getting it so that the patients look normal, it's just, it's like,
tricky.
it's where you're trying to strike that balance. And a lot of times you get it, and I'm fine with that. But when it's not right, it's like, now we have to do fat grafting. Now we have to do this. Like, I mean, if you really want to get ripped like that, I think liposuction's not a great way to do it.
And the thing is, I don't know that we've been doing it long enough to know how it ages. Like what's going to happen over time as the skin, just as it does, gets loosened up and elastic. So I don't really do a whole lot of it. That's not my deal, but there's plenty of people that do. These are just questions that I have that I'd like to see kind of sorted out before I jump into that one. But that's liposuction 201 or 302.
That's right.
This is 101.
Yeah, this is 101. Got it. So yeah, the big thing is, there's getting the contour on these areas that are bothering you is really the best way to go. It takes, time-wise, it's some work.
It takes a while, and you would think it's not, because the actual technique is, you would think it could be somewhat non-invasive because the incisions are small. They're tiny little 1 centimeter or less stab incisions in various places through which we insert these, thin cannulas to do the work. But if I'm doing a full 360 lipo on a patient, which includes the upper back, the back side of the flanks, the front side of the flanks, the abdomen, that can take me easily 3.5, 4 hours, especially depending on how much fat a person has. And then if they want to add on the arms and the legs, like it could theoretically be an all-day process, but it can't be because there are limits to how much you can take. And the numbers aren't hard and fast, but at some point it was said that 5 liters is the max you can take while still sending a patient home. If you're admitting them to a hospital setting, you can probably take more. The number is not necessarily hard and fast, but the idea is the same, that once you start getting to higher levels of removal, you're putting the patient at risk from a complication standpoint, because the body is going to have to figure out how to adjust the fluid loss and the fluid balance and the fluid coming back into the circulatory system. And it can be a lot on the heart, and you can have problems with your blood pressure and all kinds of things. So there are limits to how much you can take out. And if you are a larger individual, sometimes you do have to come back for a round 2 of liposuction. So it may have to be spaced out.
Yeah. And, we typically use, power assisted liposuction so that it doesn't take all day. But we do a lot of hand suctioning of certain areas and power assisted. And then we talked about using lasers as an adjunct, Renuvion, or the LipoEase system from the Alma lasers. I am a luminary for Alma lasers, just to cover that. But those things do help. They do help. Skin tightening and retraction.
So they'll help tighten the skin up after the liposuction is done. I think that they are great, adjuvant treatments. They're not going to necessarily take the place of a skin excision, but in the person that is not necessarily ready for a tummy tuck or needs an arm lift, they just need a little bit of extra help tightening up the skin. They are great options. And then the recovery for this, depending on how much you do and how many areas, it can be, a couple of days, or it can be, a couple of weeks. Yep. But the idea is that for the first week at least, you are going to be swollen. After that first week, the swelling will start to come down. At about 6 weeks, I think you're 90% there in terms of swelling, but you need a good 3 months before you really see all the swelling resolve.
And then it takes another, 6 to 9 months for the contraction of the skin and all that. Yeah, because you don't get cross-linking of collagen fibers till 9-10 months after surgery. Right. So you're not going to see the result, quote unquote. I mean, you'll see the result because you'll be smaller and the contours will be better. But the result of the operation really isn't apparent for about a year.
Right. But if you're looking ahead and trying to plan for a vacation, I would say give it at least 3 months before
you'll look great.
You're in your bikini and you will look really good. You can do, I would say, 2 to 3 weeks of taking off of working out and exercise, and then you can slowly start to get back into it. I do have my patients wear compression garments most of the time
for how long?
Up to 6 weeks. I do 6 weeks. I think it's better. But I do have them take breaks,
Yeah.
throughout the day, just so they're not constantly in it. And I'm a huge fan of lymphatic massage after
Me too.
liposuction.
I love lymphatic massage.
So lymphatic massage, these are special massage therapists designed to do lymphatic post-operative massages. And they do a really good job at getting that swelling out quicker and at making the overall appearance more smooth. So any little areas of lumpiness or bumpiness or scar that might want to heal wonky after the liposuction, the massages really smooth out those irregularities. And the sooner you can start it, the better the result you'll have.
That's for sure. I think, that makes a huge difference. I mean, having the masseuse or masseur really kind of get the fluid moving out of those areas.
Mm-hmm.
Because what happens is, a lot of times we see operations that are swollen after and we say, oh, that's indurated. I think there's like an in-tissue induration. You can feel the area that's been liposuctioned 6 weeks after, and it feels kind of spongy. It's not quite normal yet, even though it looks fine.
Right.
But we want it to heal.
Yeah.
And so moving that lymphatic massage is a good thing.
Right. I think the faster you can get that fluid out of there, the
Sooner
sooner
it's gonna
the
heal.
skin can snap back and reform and redrape and do what it needs to do.
Yeah, that's good. Complications, bruising and staining of the skin happens with, some liposuction. It takes a while. It ultimately goes away.
That can last a while, but it does. It goes away. I mean, there's arnica. There's even some lasers that can help with that if it's really persisting.
Fat necrosis and seroma,
Mm-hmm.
where some of the fat dies off and makes hard scars. That can happen.
happens.
It's not that common in the kind of liposuction that we do, but I've seen it from other places where they do some sort of like war crime style liposuction. It's very rough, and the skin is beat up. You see all this retraction. I think that can happen.
Yeah, I've definitely seen some fat necrosis. It usually goes away after
It does.
like a year or so. It takes a little while. The fluid collections of seromas definitely happen. Not so much a complication, but a side effect is that you're going to be numb in those areas, and that can persist for 4 or 5 months easily. But eventually that does come back. And as it comes back, you can kind of have like a pins and needles feeling as those little nerves regenerate. And then there are some serious complications. If you are working around the abdomen or the flanks, there have been reports of intra-abdominal injuries from the liposuction cannulas. And that's happened to surgeons who know what they're doing.
Totally.
But it is just a fact of what we do and where we're doing it. It's always possible that those small liposuction cannulas can actually go into the abdomen and cause a damage to the liver, spleen, bowels, organs. That's a big, big problem. I've heard of reports of people doing liposuction on the back and getting into the kidneys, of people getting into the lungs. Like, these are all things that have happened.
Oh, yeah.
They're awful. They're bad complications, but they do happen, which brings me to the last point I want to make here. Know who is doing your liposuction.
Oh, yes.
Oh my gosh. Everyone and their mother wants to do liposuction, because if you are an untrained medical person, you don't understand how terrifying these complications are. All you see is little tiny incision. How hard can it be to move your arm back and forth? And look at all the money in the bank that I can get. How hard can it be? It's a no-brainer. And so we have all these untrained practitioners, some of whom aren't even doctors,
I know,
doing liposuction because in their minds they think it's an easy procedure, and they sell it and they market it as an easy procedure. You can even do it awake. Oh my gosh, please go to a surgeon who does this routinely, because the complications can be catastrophic. There were those 2 women that came back from Mexico last year, came back, and as soon as they came back across the border, both of them died after a liposuction procedure, probably because some internal organs were perforated or something like that. I mean, this surgery seems like it's non-invasive, but it can have very serious consequences, which are very real. So please, number 1, make sure it's a surgeon. Number 2, make sure they are trained. My recommendation is a plastic surgeon, not to disparage all the OB-GYNs and internal medicine doctors out there doing these procedures, but they don't really know what they're doing.
No, I mean, this is if you looked at that steel cannula and the length of that cannula and said, I'm going to be jamming this
blindly
under your skin, you'd probably say, oh, no, you're not. because if it's used improperly,
Big problems.
It's bad.
It's a weapon.
Yeah, I mean, this is like, this gets back to my discussion about like firearms or lasers or, medications. Any of these things in the wrong hands, in the unknowledgeable, are deadly.
Yep.
And used in the hands of those who are knowledgeable, it's an instrument and can produce incredible results.
Right.
Liposuction is done by everybody and their mother, and it
frustrates me to no end because they think it's no big deal. And unless you've done a general surgery rotation and know what it means to have a perforated bowel, to have to give a person an ostomy, to have to transfuse them 10 units because they're dying in front of you from blood loss and blunt injury to the liver, unless you've seen those patients and know how bad and catastrophic those complications are, you wouldn't take it so lightly.
No.
Not to scare anybody from doing liposuction.
We're trying to scare you to board certified plastic surgeons.
Yes,
That's basically the truth.
In general,
it's the truth.
These patients do great, and they do fine if you go to someone who knows what they're doing.
But let's go back to that statistic. There are 8,000 board certified plastic surgeons in the U.S., and there are over 40,000 people practicing plastic surgery in the United States of America.
And who knows how they've been trained.
Yeah, and a lot of them are... it's not to say that they can't do it. I mean, there are probably, some doctors that are not board certified plastic surgeons who do really nice liposuction. They've taken the time, they've learned, but that's not everyone.
Yeah. Just do your homework.
Look at the results. That's the key. Always go to the page, go to their web page, look at the results, look at their Instagram. And and it is kind of like, what are you doing all the time? Like, what are these guys up to? Guys, girls, whatever. What are they up to? You need to know what they do in their practice. Like I do a lot of noses, a lot of faces, but 20% of my people that are on the table are getting liposuction. That's like a fifth of my people. But it's like they're coming for other stuff, and then it's like, and by the way, while you're there, how about
right? And I'd say that's pretty accurate for most. If you are a busy plastic surgeon, no matter what your quote specialty is, you're probably doing a decent amount of liposuction because
I do a ton.
It's very much added on to a lot of what we do.
But like I think in absolute square footage, you've got me beaten by a lot. I've been in practice 15 years longer than you.
Yes. I'm on that spectrum of patients who use it for weight loss. Mine go more towards that upper
Totally.
limit, which is fine. We all need a little help.
But the results are awesome. So that's the take home message. But we'll get into it more with since this is our 101 series, we're going to stay short and sweet. And this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.